Hi Misty, I'm Lisa. I'm going to be doing your physical exam today. I will be touching you for this exam. Are you okay with that?
Yes.
Okay. So as I'm speaking to Misty, I'm looking at her skin, just overall wellness, looking at her clothing. She is willing to interact with me. I'm going to, I've washed my hands. I'm going to palpate her radial pulse, 15 seconds. Multiply that by 4. While I'm holding my fingers on her wrist, I'm going to count her respirations for 30 seconds, multiply that by 2 for a minute. Okay, then I'm looking at her skin, her fingernails, cap refill, less than 2. I'm not seeing any skin lesions, any problems with her skin, nails, arms, hands. Hair looks like it's has normal growth. At this time, Misty, I'm going to inspect your head, I'm going to inspect your scalp, and then down to your neck, okay?
Okay.
So I'm just touching her head, I'm feeling for masses, pain. Are you having any pain or tenderness?
No.
Okay, so I'm going to go to the major lymph nodes. I'm starting with the occiput, post-auricle, any tenderness?
No.
Preauricle, submandibular, submental, post-cervical, precervical, supraclavicular, and infraclavicular. I'm using the pads of my fingers. I'm not finding any masses, no tenderness, Misty.
No.
Okay, and I'm looking at her facial expressions. Smile at me. No asymmetry or problems noted. I'm going to go to the cranial nerves. I have a scent. This is first cranial nerve, olfactory. Misty, what do you smell?
Peppermint.
Okay. I'm going to be looking at her eyes. We are looking to make sure that she sees in all 4 quadrants. So Misty, I need you to look watch my finger. We're going this way. Don't move your head, just your eyes. Down to the midline, across, up, down. Okay, so she has followed, she's done direct and consensual pupillary responses is what we're going to look at next. Okay, so Misty, just look at my nose. I'm looking at her pupils. I'm looking at her left, and now her right for consensual. Again, the other side, and one more time for consensual. They are equal and reactive to the light. I'm going to be looking at her I'm going to be looking at the red reflexes and looking at the disc. Okay, so I'm looking in her eye. Okay, the other one. Okay, no abnormalities noted. Visual acuity can be checked on the Snellen chart. Okay, that was 3rd and 4th, so the oculomotor, trochlear, as well as the abducens. She was able to follow a moving target. Next is going to be the sharp and dull pinprick facial sensation. That is the trigeminal 5. Okay, Misty, tell me soft or sharp?
Soft.
Okay, again?
Sharp.
Okay, again?
Soft.
Again?
Sharp.
Okay. Okay, tell me if you can feel a wisp.
Yes.
Yes, again? One more time.
Yes.
You feel it all? Okay.
Yeah.
Okay, I want you to clench your teeth. Okay, and I'm feeling her mandible, make sure the muscles are okay. Smile big with your eyes clenched. Okay, and then puff out your cheeks. Okay, we were testing 7th cranial nerve, the facial nerve. I need her to, I'm gonna have her open her mouth, look at her tongue. We're gonna make sure the uvula is symmetrical and moves with her saying ah. Okay, tongue out, all the way out. Okay, and then ah.
Ah.
Okay, and then while I'm here, I'm looking at dentation, no damage, tongue up. Okay, no lesions noted. Okay, the other one, so Misty, I want you to turn your head against my pressure. Okay, again. Okay, shrug your shoulders up against my pressure. That was the 11th cranial nerve, the spinal accessory. The 12th, stick out your tongue, move it side to side. Okay, normal movements there. Misty passed the cranial nerve 8. She was able to hear and follow all my commands appropriately. We're gonna move on to her neck. We're looking at her, the trachea. Make sure that it's it is symmetrical. I'm gonna feel from behind. So Misty, I'm gonna touch you from behind, okay? So on your neck, I'm feeling to make sure there's no masses, that it is symmetrical. Feeling for thyroid enlargement, I'm palpating thyroid. Any tenderness there, Misty?
No.
Okay. For the range of motion of your neck, put your head down, up, and then back to level, and then side to side. Any pain?
No.
No pain limitations noted. We did the pupillary response, and peripheral vision is another one we need to do. So Misty, when you see my fingers, I want you to say yes, okay? So as they come
Yes.
forward, okay, yes. Your gazes. So I'm looking at Misty's eyes, I'm looking at eyelids, I'm gonna just look at conjunctiva. No redness or paleness noted. We have, it looks like the sclera is moist. Okay, so I'm gonna be looking at your ears, just look at the pinna, and then I'm gonna use the otoscope to look inside, okay?
Okay.
Okay, so outside of ear, no lesions noted, no problems, no tenderness, Misty? Okay, so now I'm looking inside. Tympanic membrane visualized, no cerumen. Okay, any tenderness on the outside? Okay, up and back to see the ear. Tympanic membrane visualized. No abnormalities noted. Okay, so I'm gonna look up Misty's nares. So I'm looking up nares. I see both sides. No lesions or problems noted. Misty, can you block off one nasal passage in and out?
Yeah.
Other side, in and out, okay? Both nares are patent. Do you have any tenderness when I palpate here?
No.
How about up in here?
No.
Okay. We did, okay, so now I'm gonna look at Misty's back. So I'm inspecting Misty's back for symmetry, curvature, any tenderness?
No.
Okay, it's aligned. Okay, while I'm inspecting Misty's back, I'm gonna see how she's breathing. Making sure her lungs expand symmetrically. Okay, Misty, I'm also gonna listen to your lung fields back here. As I go, she's going to inhale and exhale. Inhale, exhale. Inhale, exhale. Don't pass out. Inhale, exhale. Inhale, exhale. Inhale, exhale. That's on her back. Oh, the other one I need to check is tactile fremitus. Say 99.
99.
Again.
99.
Again.
99.
And one more time.
99.
Okay. No fremitus noted. Okay, Misty, I'm also going to listen to your lung fields in the front as well as your heart, okay? So I'm gonna be listening. So, inspiration, expiration. Inspiration, expiration. Okay, then I'm listening to her heart. I'm gonna go aortic, pulmonic, second pulmonic, tricuspid, mitral. Misty, I also need to palpate the point of maximal impulse. It's gonna be fifth rib intercostal space at the mid-clavicular line, so counting ribs down to the fifth. Feeling no heaves or bruits noted. Okay, on your neck I also need to listen, okay? No JVDs noted. I'm gonna listen for bruits. Both sides. No bruits noted. Okay, Misty, I'm gonna have you lie flat. So at this point, I am inspecting Misty's abdomen for symmetry, masses, any abnormalities. I'm not seeing any abnormalities, masses. I'm gonna auscultate before I palpate. I'm gonna note for bowel sounds and bruits. Bowel sounds within normal limits. I'm going to percuss. So Misty, you're gonna feel me tapping. Misty, I'm also going to palpate lightly. Any tenderness?
No.
Okay. Tympani was within normal limits and no masses noted. Bowel sounds within normal limits. At this point, I'm going to move down to Misty's legs. I'm gonna inspect for muscle, symmetry, any abnormalities or joint abnormalities. Okay, Misty, I'm gonna have you bend your knee. Okay, any pain in the knees?
No.
Down into the feet?
No.
Okay, I'm inspecting feet. I'm feeling dorsalis pedis and posterior tibialis pulses, both within normal limits. I'm not seeing any edema. I'm checking for her cap refill with her shoes off, shoes and socks off. Okay, Misty, I'm gonna have you bend your knee up. Any pain with this movement?
No.
Okay. Okay, the other leg. Any pain coming into the knee?
No.
Down into, I'm feeling pulses, dorsalis pedis, posterior tib, cap refill, bending the knee. Any pain or tenderness?
No.
Okay. Okay, Misty, I'm going to have you sit up on the side of the bed again. Okay, I'm gonna be testing your reflexes. Okay, so we have bicep reflex. So I'm just testing for her bicep reflex. Tricep. Brachioradialis. Brachioradialis. Oh my gosh, I can't say it. I'm seeing movement of each. Patellar reflex. Leg hanging. Patellar on both bilaterally, as well as the biceps, triceps, and brachioradialis bilaterally. Achilles reflex. So just let it hang low. Achilles, as well as plantar. All were reactive. Okay, Misty, if you can tap your fingers together, each finger to thumb, finger to thumb, finger to thumb. Okay, and then tap your feet on the floor if you can reach, or just, there you go. Okay. Misty, I also need you to, I want you to touch your nose to my finger, and I'm gonna move it around. Go ahead.
Put my finger to my nose and to your finger.
Yes, that. Finger to nose, finger to nose, finger to nose, finger to nose, okay. And then your heel to shin. So I want you to scrape your heel up to your knee, both legs, okay? And I'm going to wash my hands, and that concludes my physical exam. Thank you, Misty.